Bob, you and I, many of our viewers are probably suffering from joint pain with this cold weather. It might be from poor diet.
That's right.
It just might be arthritis just nagging in on them. So we're going to show you a couple options that are going to help reduce and stop that pain without meds. That means no side effects. Hold on, and we're going to get right to it. Bob, any additions?
It's snowing outside.
Yeah, it's snowing outside today, so it's all fitting together.
Bob and Brad, the two most famous physical therapists on the internet.
All right, Bob, did a little homework on this, and I found
Good for you.
I found an article recent, January of 2022, written by Deborah, I hope I get the name right, Fulham Bruce, PhD. This article was reviewed by a medical doctor, and this information is good. Plus, we got over 57 years of clinical experience.
God, we're old.
Yeah, hands-on, and we found this all consistent with,
It's true.
Exactly right. All right, Bob, I think there's going to be no surprise. One of the things you can do with that joint pain is use some heat on it.
Feels good.
It feels good. The other thing, the second option in this article, which is not a real big surprise to us, is cold. Yeah, use cold packs.
Whatever temperature trigger.
I've got to admit, in my practice over the last 25 years, I can think of one person with severe arthritis, and she really liked cold. Most people most people like heat, but there's always that option. So we're going to cover that as well. Now, with heat, one of the things that it does is it helps dilate the vessels, increase circulation, more blood flow, and that helps. It feels good.
Right.
We're going to talk about differences of what type of heat to use for options. Cold, on the other hand, restricts and actually pushes some fluid out. There's some numbing effect from cold that can help reduce the pain. Whatever, you can try each one and see what happens.
Cold in your back, right?
Oh, yeah. I'm a cold person. I don't know if it's an arthritic problem. I don't think. It might be coming up, though. All right, so we're going to get first options of heat that you can use. Number one, therapists, I think we've always used moist hot packs. And we have these hydroculators that these hot packs are soaking in hot water, and you use them. But people don't have those at home.
Absolutely not.
To make it simple, a few good options is simply a warm shower, doing the dishes in warm water, get those hands warmed up, a hot tub. Some people, you could use a hot sauna or a steam room. However, if you do that, you really got to make sure the doctor okays it. If you have a heart problem, you may not want to go into a hot tub, a steam room. Yep, you can have problems with that. Other options for at home is simply hot packs. So if you happen to have, there are cold and hot packs that you can do both of. You can either put this in the freezer, it comes out cold,
the microwave,
or put it in the microwave, and there will be instructions on it how long to put it in there, and put that on your aching joints. The other option is an electric hot pack. Now, there's standard hot packs that come, and they usually have 2 or 3 temperatures. Big caution with hot packs like that. They're conventional. They don't go real deep. They go about skin deep. They feel good, but you have to be careful. If you put it on all the way high and you fall asleep with it, Bob and I have both had patients that have burned themselves because they fell asleep with a hot pack on high, and it can be a problem.
Absolutely.
Now, the other type of hot pack, this costs more, but it is definitely more superior. It's far infrared. It's a special type of hot pack. Far infrared rays will heat up deep into your tissues.
2.36 inches.
Right, over 2 inches, and you can leave them on much longer. They don't. This particular one here, we like Thermotex. It only goes, I believe, 107 degrees is what it heats up to. There's only one setting. And it goes deep. And you can leave that on up to 45 minutes without concern. So that's another excellent option. All right, if you have not tried cold on those sore joints, you can try it. An easy way to do it without spending any money is go to your freezer, and maybe you're going to have a package of mixed vegetables, corn, peas, whatever it may be. They work well. They're cold. If you got a knee joint pain, you simply put it right over your knee. Do not put cold directly on your skin. There's a potential to get
And do
frostbite.
you eat the peas?
Well, you can maybe unthaw them on your knee and then put them in and boil them good.
Really good.
Typically, patients I've had, they designate
Right.
one bag
Bag
of
for that,
frozen peas for their cold pack. So that's an option. If this works well, you can actually make a cold pack that works very well.
Yep.
I've used one.
Very popular.
Simply go to the store and get some rubbing alcohol. It does make a difference on the percent alcohol. This is 91%. I think you
The
can get
more
it.
the better.
Not necessarily, just changes the ratio. So here's an example. I made this last night. I took 2 freezer bags, and you can see it says cold pack on there, so no one uses this for anything else. And I put one of these in, and
Right.
then 2 waters. So
Right.
the ratio is 2 waters to 1 rubbing alcohol. This is 91%, which I haven't used before. I've always used a lesser, and this will not freeze. It's just cold water now, which is nice because it's darn cold, and it actually goes over the top. Now, what I would do with this is I would dump some of it out and add more water
Sure.
because I like it so it turns slushy.
Right.
If I use the alcohol with the, I think it's 70-some%, this would probably come out slushy, and that's something you have to learn.
Got it.
But these work well. You get done with it, put it back in the freezer. Want to hold on to that, baby?
It's cold.
You're darn right it's cold,
My
Bob.
gosh.
It's a cold pack. Okay.
Hence the name.
Yes. Or you can simply, you know, if you have one of these nice cold packs, make sure you get a good one.
Right.
Make sure, because cheap ones you put in the freezer,
It's a big brick.
yeah, and they come out and they're hard.
Right.
Those are the El Cheapos. They're not really worth buying. You're better off making one. Otherwise, it should come out soft. You can wrap it around the joint, your shoulder, your hand, whatever it may be. And the nicer ones like this one, we like I Relieve. They make an excellent quality one. You can put it in the, use it for a hot pack
Right.
as well.
Both sides.
Yep, double for your
Whammy.
double whammy, 2 for the price of 1 type of deal. Also, put some ice in a
Ice water.
Yep, ice water. Put some water in there. It's pretty aggressive.
Oh, very good.
Yeah, some people like it. It's not going to
Not
be
for
for a
me.
lot of people.
Right.
So again, cold 10 to 20 minutes, not longer than 20 minutes is going to be all you need. Again, never on your direct skin. And, I think these things can help. No side effects.
If I hold hands with my wife, she got cold hands.
So you got cold hands, warm heart.
Right.
Yeah, you're a lucky man,
Freeze
Bob.
me up.
All right, very good. Enjoy the winter. Keep those hands, feet, and joints feeling good.
You love winter, don't you, Brad?
What?
Love winter?
Oh, winter. Yeah, my favorite. It's becoming more and more my favorite
All right.
season to go down
What a
south.
liar.
Take care.